Hello everyone, welcome to Planet Ayurveda channel. So today we are here again with some of the FAQs for you all that we usually get on the phone calls and consultations, video consultations, and even on our YouTube videos. So today we have Dr. Vikram sir with us and he will answer all your queries in this video. So watch till the end. Let's start. Hello sir.
Hello.
So the first question is, what is this ITP?
What is ITP?
Yes sir.
ITP is the full name is Idiopathic Thrombocytopenic Purpura. Okay. It is when it is an autoimmune disorder when the platelet counts gets very low.
Okay. So the next question is, why do platelets drop in this disease?
Because it is as I said, it is an autoimmune disorder. The body's own immunity attacks the platelets. So the platelets, whenever they are made in the bone marrow is working perfectly fine. There is no problem with the bone marrow. The production is going on fine, but when they come in the blood, they are destroyed by our own immunity. So the treatment is to modify the immunity, to give the intelligence to the immunity to recognize that these are our own cells, not to destroy it.
Okay, thank you, sir.
And that is possible in Ayurveda.
Okay, that means it mistakenly starts to kill the own cells. Cells. Okay.
In all autoimmune disorders,
it happens.
This is what is happening.
Okay.
And in autoimmune disorders, Ayurveda has a great role to play.
Okay, sir. Now, the next question is a little long.
Yeah.
Why do platelets fluctuate in my ITP? So I am diagnosed with ITP and I am on treatment.
Yes.
But the platelet count always fluctuate. And this creates a lot of confusion, anxiety. My life, I am worried that platelet count sometimes drops suddenly.
Yes.
It can cause bleeding and it may cause life risk also.
Of course, when the platelet count is less than 10,000, it is very risky. So if the platelet count is above between 10,000 to 20,000, it is not that risky, but it is still to be observed. If it is above 20,000, so it is not risky, so you don't have to panic and you can live your comfortable life, but you don't have to run or play sports and avoid injuries.
Okay.
And why the counts they fluctuate? It is normal tendency of the disease. Platelets, they come out in the blood, they are made in the bone marrow and the immunity attacks it. Immunity takes some time to kill them. Sometimes it kills them quickly, sometimes it takes some time. So we are giving Ayurvedic medicines. The platelets, they go up and the immunity kills it. Then they go down. And slowly, the immunity learns with our medicines, Ayurvedic medicine, the immunity learns, it modifies its behavior and then it stops completely to kill the platelets. So the ITP is cured slowly and there is no ITP anymore. So that's why ITP patients, the counts, it fluctuates.
Yeah. So the next question I am getting from your answer.
I want to interrupt because I want to add something. Sometimes the patient gets frustrated after using the medicine for 1 month, 2 months, 3 months, and they feel that this platelet ITP is not getting cured.
Yes.
In many patients, I have observed that it gets cured after 6 months, after 1 year, and in some rare cases after 2 years also. So it is very important to continue the medicine for longer period of time. In my first patient, when I saw ITP case, he was cured within 2-3 days.
Okay.
So it was you can say beginner's luck, and after that many patients, they are fine after 1 month, 2 months or 6 months.
Consistency is important.
Yes.
Of the medicines. So, sir, is it common that will fluctuate in every patient, or it depends patient to patient?
It fluctuates from patient to patient. Every person is different, every child is different, every person's prakriti or constitution is different according to Ayurveda. So every person's diet is different, but it fluctuates. Some people, they are healed very quickly, some people, they take some time. According to modern medical system, it is not curable. The doctor says it can cure itself on its own also.
Yes.
But many patients, they keep suffering, and so they should take. Many patients, they tell me that they just followed our diet. in ITP, and they were fine, at least 70% fine with the diet only, without taking any Ayurvedic medicine or anything. So I have made some diet videos also on ITP.
Yes.
So if they follow the green juice and red juice regimen,
Yes.
and it will definitely help them.
Yes, I will add here that we have also made some shorts for you just with the green juice recipes and red juice recipes. You can check that too.
Okay.
And also, if you have a question that are our testimonials real? So yes, these are real. You can get to know that what sir said, that patients are getting healed within 1 month or within a week or in 2 years as well. So all the testimonials are uploaded on our video.
Yes, this is a good point you raised, because many patients, when they are doing consultation, sir, we don't know whether the video is real or
Yes,
video is not real.
Yes, sir. This is a common
So it is because internet is full of so many fake things.
question. Yes, sir.
But I invite people who think it is video real or video is fake. They can come to our clinic. They can meet real people. They are visiting us, and there are so many follow-up cases.
Yes, sir.
And sometimes, after taking patient's permission, we can even share their phone numbers also with you.
Yes. And as the patients generally ask, sir, that are the videos real or not? And what we see that they also make the video then after getting treated.
Yes, yes.
And it's a main thing.
Yes.
So the next question is, does this ITP transfer into some other disease which is more dangerous, like say blood cancer?
No. In my experience, I have observed ITP patient stays ITP patients. So you don't have to be worried about that it will be converted into blood cancer or any other disease. So it is not. It is ITP in most of the case.
Okay. Next is, can this disease be transferred to the children, like genetically?
No, it is not genetically. Whatever I have observed and read, that it is usually occurring in one's lifetime. So it is affecting some people all of a sudden. So there is no concrete evidence whether it is genetic or whether it is not genetic. But according to Ayurveda, it is not genetic.
Okay. So here another question is coming, that is every disease is ITP whenever platelets drops?
No, that is another good question. There are so many diseases where the platelet count comes down. There is dengue, there is other viral infections. Even with the simple viral infection or the simple sinusitis or the sore throat, or the whenever there is some infection in the upper respiratory tract, the platelets they may come down. So there are so many diseases where they come down, then they go up. That is not ITP. ITP is autoimmune.
Okay, sir, can we relate the platelet count drop with weak immunity, when immunity gets weakened?
No, it is not related with the weak immunity.
Okay.
Immune cells are different. Red blood cells are different. There are different types of cells which are produced in the bone marrow.
Okay.
There are red blood cells, there are white blood cells, and there are platelets. So white blood cells, that is immunity.
Okay.
Red blood cells is hemoglobin, and platelet is something to which they stop the bleeding.
Okay.
For clotting purpose.
Okay, sir. Next is, how long will this disease be with me? So I'm tired of having this disease. Is there any chance of cure? Or will this disease leave me completely at some point of time?
Yes, that's what I have observed and I have
observed.
seen.
Yes.
It is possible to get rid of the disease. I cannot say I can cure 100% of the patients.
Yes.
But I have seen all those 100% who followed the treatment for 1 year, 2 years, or maybe 2.5 years. So they were fine with the treatment. And at least the fluctuation they stopped. The count is usually above 100,000, 1 lakh or 150,000. So they were always above the danger mark.
And sir, even after getting treated with ITP,
Yes.
people have a doubt that it may recur or something. So they can just take the green juice and red juice for life?
Yes. Green juice, red juice,
like-
everybody can take. Even if
Yes.
I take, you take, or whosoever. It's nothing. It's just green vegetables and green leafy things, and green apples,
and
green. So green things, and red is pomegranate and
Carrots.
carrots and these beetroots.
Okay.
And apples, red apples and green apples in green juice.
Okay. So doctor recommending me splenectomy. Should I go for it or not?
Splenectomy I don't recommend because I have seen very good results with the Ayurvedic treatment, and the people who are suffering from ITP, usually they are advised to remove their spleen. It is called splenectomy, but spleen is the house for our immunity. If we remove it, our immunity is affected. So I would suggest you should wait for it. Just follow the diet which I am recommending. Avoid milk and milk products, all kind of milk products, even the goat milk, all milk products,
To be avoided.
sweets, chocolates, anything containing milk solids.
Even the plant-based.
Even
milks?
the no plant-based milks are okay.
Okay.
Animal-based proteins are not good. Non-vegetarian food not good. Animal-based milk products not good. Yogurt, buttermilk, cheese,
Plant-based milk like coconut milk or soy milk.
coconut, soya milk, rice milk, oats milk, all these almond milk, they are all
Plant-based
fine.
milk.
They are all okay.
So the next is, why does the immune system behave abnormally in these patients?
Immune system is actually responding to the antigens. Any foreign element or foreign protein element which comes in our blood somehow. So whenever an alien or a harming protein molecules they enter our blood, our immune system is trying to watch it and save it in the memory, whether it is friendly protein, whether it is harmful. So sometimes when the immune system loses the signaling or signaling capacity in between, or the intelligence is lost, they just correlate the same antigens with the platelets. So that's called autoimmune disorder. This happens in all the autoimmune disorders. According to Ayurveda, this can happen anytime, in any situation, depending on environment, pollution, food, or incompatible diets, lifestyle, so many things, stress also. So once an autoimmune disease appears, so it takes a lot of time and effort to correct it. So the immune system starts attacking the platelets in this case.
Okay, the next is it something to do with your diet or lifestyle? So sir has already explained this, but we will ask sir that what type of lifestyle can lead to ITP?
Well, according to Ayurveda, ITP is called Rakta Pitta. Rakta means blood and Pitta means the fire. Our body is made up of 5 elements: earth, water, fire, air and space, according to Ayurvedic philosophy, Ayurvedic principles, and Ayurvedic way of thinking, and culture and tradition and description in the text. So Rakta Pitta is when the Pitta is more in the blood. Pitta is fire element. So if the fire is more in the blood, it burns the platelets. So fire is when if you are consuming too much spicy food, if you are consuming too much of sour foods. I also tell my patients from Ayurvedic, the protein I stopped from modern point of view, that if you are eating too much of animal protein, then it can trigger some autoimmune reaction. This sour things I am stopping from Ayurvedic angle, because too much sour and too much spicy food can increase the pitta, so it should be avoided. And sour and like lemon, oranges, kiwi, pineapple, they are incompatible with the milk products.
And our
They should be
sedentary
avoided.
lifestyle also plays a role, sir, here.
Sedentary lifestyle plays in all lifestyle diseases. So it's, of course, we should exercise. We should be active.
Okay, so the next question is, platelets are 10,000. Is there any risk of life?
I have seen in my life some patients where the platelet count was only 500, or some patients even 0. I was even surprised to see no platelets. So the patient was sitting in front of me. I was surprised. I asked the patient, why don't you take him to hospital? He said, I took my child to hospital several times. He gets the count around 500, 1000. That is the maximum he gets after spending a lot of money, after giving IVIG injections, and after giving the platelets also. So they were fed up from all these procedures. After spending a lot of money, the platelet count was not increasing beyond 500 or 1000 or 2000. So it is dangerous. It can cause bleeding, but less than 10,000 is always dangerous.
And again, it depends upon patient to patient.
Of course, it depends on patient. So we give the treatment, and of course, if you follow the diet, it will come up.
Yes. And the next is how long to continue treatment for ITP. That sir has already explained, but if anything you want to add here.
If you want to test whether this video is real or fake,
Yes.
there is one important thing. Just start following the diet, which I told you. It is free, it is available everywhere around the world. No animal proteins. Consume green juice and red juice, and that's it. So after 1 month, you will see things are changing. So it's not going to cost you anything. So ITP can be managed in Ayurveda very well.
Yes. So the next question is alcohol consumption solely can result in low platelets?
Alcohol, of course, the principle of Ayurveda, according to Ayurvedic principles, alcohol is drying and alcohol is heating. Too much pitta, too much fire.
Yes, as you explained, it is Rakta.
So if you put in our body more fiery things, which increase the...
will trigger.
Yes, so it can trigger, it has properties entirely opposite to the ojas. Alcohol is ojas is the immunity of our body.
Yes.
Or the aura of our body. So alcohol is opposite, so it is not recommended at all.
Okay. So the next is what are the common signs of low platelets in ITP?
In ITP, the signs and symptoms, usually the patients, they see the bluish or reddish spots or blackish spots on the body. So they appear and disappear. They are bleeding marks. So they are bruises. So because of the low platelets, there is easily bleeding in these capillaries. They break up and the blood comes out and it's not clotting. So signs is mainly this, and fatigue and tiredness is also one of the symptoms.
So sir, as you have already explained that splenectomy you don't recommend.
No.
And the next question is related to that. What are the side effects or indications of splenectomy?
I don't recommend splenectomy, so I won't say that these are the indications.
Okay.
Where you can remove the spleen in this condition. Okay, the modern doctors and surgeons, these hematologists, they decide on when to remove, but I don't recommend to remove the spleen. You should try this diet.
Okay, so the actual thing is, what are the side effects if they go for
Side effects?
Yes.
Well, it is a source of our, storage house for our immune cells. It is like a check post. It's like a big army base. Our own army lives there. It is a cantonment. Okay. So if you remove the cantonment of your own country, so what the side effects you will get?
Yes.
You are removing your own immunity. You are decreasing. So you may get more infections or more problems.
And more of the diseases.
More diseases. So it is better to wait and avoid.
Okay. So the next is, how does ITP occur in infants or small children, little children?
Yes, it can. The immune system can trigger in many ways. It can be some viral infection also. I have observed in my patient that if there is some viral infection, flu or something, the platelets comes down. So some viral infections, some bacterial infections, some antibiotics, some incompatible foods. Some people, they say, I don't mix foods and I'm leading a very healthy lifestyle. So he might have got some viral disease. Okay. I have seen the patient where this vaccine was also responsible for this ITP, COVID vaccine. Okay. Post-COVID thrombocytopenia is very common, and I have seen many patients.
So the next is, if ITP occur in children, are there any major complications?
No, in fact, I have observed that in children it is easier to treat.
Recover.
It is easier to recover.
Okay.
But in adults also, many adult patients, they also recover very well, but it takes some time in adults.
Okay. So the next, what is the most common treatment that you give for ITP?
I give this diet, which I have told you. Mainly, I give some herbal preparations. I have used some plants like Karika papaya and some spirulina and some pitta reducing medicines, herbs which are calming down the fire element in the body, which are modifying the immunomodulators like giloy is there, this Tinospora gaudifolia, this spirulina, such carica papaya.
Rest the combo depends upon patient to patient, so
Yeah.
it's always better
So
to
it is
consult
always
Ayurveda
changing.
expert.
Basic combo pack I have mentioned at my website, but
Yes.
you can start with that, and even with that also, the purpose is to calm down the pitta or the fire.
Okay. So the next is there any role of bone marrow transplant in ITP?
The bone marrow is perfectly fine in case of ITP. So nobody recommends bone marrow transplantation because bone marrow is working fine. There is nothing wrong with the bone marrow. It is producing the platelets. The platelets are destroyed in the blood.
Okay, so it has no role basically
No role.
in ITP. Can ITP managed with Ayurvedic medicines? Yes, this is already answered and
Yes.
it has come many times. Can papaya fruit or leaves intake increase platelets?
Yes, I have observed. I have seen. I am using papaya leaves. It's good for ITP.
In the form of carica papaya, we have the product.
Yes.
And also you can have the papaya
You can put the leaves in the juice, green juice.
green juice. Yes. Can I plan pregnancy during ITP?
Yeah, it depends upon what is the count. So it is better to treat ITP first, then you can go for it.
So the next is a related question. What will be the treatment if ITP is diagnosed after conceiving during the pregnancy?
Then green juice and red juice,
Okay.
and of course some Ayurvedic medicine which I am telling you, so which I am recommending to my patients. They can be given. In fact, the pearls from the seabed and some seashells, we are purifying them, we are processing them and making the medicine from them, and they are very cooling and calming, and moreover they are rich in calcium. So in pregnant lady, calcium is recommended.
Like we have said that pitta balance and which pishtis are there.
Yes.
Mukta pishtis.
Yes. The calcium compounds are there. Mukta is pearl.
Yes.
So this pitta balance is the formulation which I usually give to children and pregnant women also.
And also again the treatment is to be personalized as per the patient condition and pregnancy issues as well.
Yeah.
So the next question is what is refractory ITP and what is the treatment?
Refractory, which is coming again and again,
Okay.
coming
recurrent.
and recurrent.
Okay.
So it is possible to,
Manage.
yeah.
Okay. Difference between blood cancer and ITP?
Blood cancer, there are different lines of cells which are produced by the bone marrow. So if the bone marrow is in blood cancer, the bone marrow is usually affected. So it is not producing good quality of all lines of these blood cells.
So here we got the major difference that
Yes.
bone marrow is not working
Yes,
properly.
in
And
blood-
ITP you
yes.
have already cleared it.
Yes, in blood cancer, bone marrow transplantation is done sometimes. Chemotherapy is given, and the red blood cells or white blood cells, they are also not properly formed. So this is, and all three types of cells sometimes are not properly formed.
Okay. So the next question is what are the advantages or side effects of Eltrombopag and Romiflostim?
These are autoimmune, immunity suppressing medicines. Romiflostim and these injections are very costly, and they are suppressing the immunity. So they are temporary solution to this ITP. It can be used in case of emergency. They raise the platelets in some patients for some time. So if it is working for you, you can use them in case of emergency. But for permanent solution, Ayurveda is always recommended. Other than this Thrombocytopenic, there is tranexamic acid, which is also temporary blood clotting agent. Some medicine, in modern medicine, they are using it.
So here I will also clear one doubt of people that if you start Ayurvedic medicines with any doctor, then it is not compulsory to stop the modern medicines perfectly.
Yes, you can use them along with.
Yes.
So it is, if there is any emergency and the count is not increasing, then you can go for a temporary solution by giving some IVIG, immunoglobulin injections. They also
In case of emergency.
Yes, sometimes they can raise the platelet for some, and also platelet infusion is also sometimes given.
So here are some new questions to me as well. So I will also learn. Is mild thrombocytopenia ITP?
No, it depends upon clinical observation and the laboratory picture of the patient. How the mild thrombocytopenia can be because of so many reasons, because of the liver issues, because of other issues in the blood. So it may not be ITP. It may be some liver disease also.
Okay. So is bone marrow test important for diagnosis of ITP?
Yes, mostly doctors, they go for bone marrow analysis to see that whether the bone marrow is working fine or it is not working fine. But it can be diagnosed clinically also by observing by experienced doctor, that they don't go for the bone marrow examination, and most of the cases we can skip the bone marrow test and see that it is clearly ITP from our experience. So experienced hematologist can easily diagnose ITP from other, he doesn't have to go through bone marrow test.
So can we please know that how an Ayurveda expert can diagnose it without the test?
From the clinical symptoms and the experience, as I told you, not only Ayurveda practitioner but also modern doctors, they can also, who are experienced doctors, they can just by looking at the symptoms and clinical features, they can immediately tell that this is ITP.
ITP. Okay. So if a patient had 10,000 platelets, is there any chance of bleeding during the bone marrow test?
I think nobody is recommending bone marrow test when the count is 10,000.
Okay.
So it is not recommended during such a low count. So
Can we stop ITP medicines after recovery?
yes, of course, once it is certain above certain point, then you can leave them.
If we reduce it slowly.
Slowly we reduce it after 1 month or 2 months, we can completely. There are so many patients, they are recovered from ITP and they are fine, not taking any medicines.
Okay. Sir, are there any signs from which the patient himself can know that he has ITP or not?
The same sign and symptom,
That
bruises and bluish marks, they can go for the CBC test.
And some of our other questions are already answered by sir, like is there a cure for ITP? Yes, it is manageable well with Ayurvedic medicines.
Yes.
And the next is how to increase blood count with diet. So there are many videos made by Dr. Vikram Chauhan as well as his team of Ayurveda experts on ITP diet. And even we have the articles on it, so you can read about it or watch the videos. And the next is what is ITP's latest treatment and natural cure by alternative medicines, like medicine's name.
These are the latest treatments which I am telling you. Actually, these are the most ancient methods,
And the latest as well.
and the latest, because in current system of medicine, only the immunosuppressants and immunoglobulins are given. These romiplastim and such injections. But in many patients, they are not able to give the results. The patients are still suffering. So those patients, they should use Ayurveda and they should try Ayurveda, and they will see the results themselves.
So we have...
And I invite all the patients who recovered, they should come to this place and they should talk about it.
Yes. And sir, as we are getting questions on its full form. First, we have answered about thrombocytopenia.
Yeah.
Now the question is Purpura seen in all patients of ITP?
Purpura is when you see these reddish spots on your skin. So that is called tiny red spots on your skin. That is called purpura. It's a clinical sign.
And it's not in all the patients?
It is not in only in ITP. It can be in any other condition. Many conditions that has purpura.
Okay.
Usually it is related to purpura is a sign which is doctors are using to explain to the medical faculties that this patient is having purpura or not having. This can be in many other diseases.
Okay. So here we have the last question. Are there any certain medicines which decrease the amount of platelets?
Of course, there are medicines. There are many antibiotics. There are many painkillers. So the use of antibiotics in painkillers should be avoided, and indiscriminatory use should be stopped immediately by many doctors who are just doing clinical practice. They are giving a lot of pills together. Sometimes there are interactions, contraindications.
People are doing self-medication.
Self-medication, of course. So this can lead to such immune reactions.
So I think this is really a very good talk with Dr. Vikram sir, and we have answered almost all the questions. But still, if you have any questions left with you, you can always drop in the comments box. And the links to the diet charts of ITP, the videos of ITP, all will be given in the description of this video. So you can check anytime. And for any health queries, our Ayurveda experts are always available for you. So you can book your consultation from anywhere in the world. And the home delivery of medicines worldwide is also available. So thank you so much, sir.
Thank you very much. Thank you.
Planet Ayurveda, founded in 2002 by Dr. Vikram Chauhan, MD Ayurveda. Dr. Vikram Chauhan का एक ही मोटिव है, हर घर आयुर्वेदा। प्लैनेट आयुर्वेदा के जरिए डॉक्टर विक्रम चौहान आयुर्वेदा को दुनिया के हर कोने में पहुंचाते हैं ताकि लोग नेचुरली हेल्दी लाइफ जी सके। प्लैनेट आयुर्वेदा का हेड ऑफिस मोहाली, पंजाब में है। प्लैनेट आयुर्वेदा पूरे प्लैनेट पर आयुर्वेदा को प्रमोट कर रहा है। बीमारी कोई भी हो, फैटी लिवर, लिवर सिरोसिस, अल्सरेटिव कोलाइटिस, ITP, chronic kidney, skin, lung diseases, neck, back, knee pains, arthritis, psoriasis, migraine, gynae problems, diabetes, belly fat या और कोई सॉल्यूशन सिर्फ एक, पूरे प्लैनेट के लोगों की सेहत का नंबर 1 साथी।
अब घर बैठे ऑनलाइन कंसल्टेशंस करें टॉप MD आयुर्वेदा स्पेशलिस्ट के साथ। इंडिया का बेस्ट ऑनलाइन आयुर्वेदिक क्लिनिक और पाएं सारी आयुर्वेदिक मेडिसिन की होम डिलीवरी वर्ल्ड वाइड। प्रॉब्लम कोई भी हो, सोल्यूशन सिर्फ एक। www.planetayurveda.com।
Log on to www.planetayurveda.com and order a full range of Ayurvedic medicines and herbal supplements delivered worldwide.